One of the things that's happened.
A little extra time and okay now.
Go for it.
One of the things that's happened to me over the years, now that I'm a legal midwife, is I'm certainly getting a lot of the studies that are done through the Journal of Nurse Midwifery, through the Birth Journal, that really back up the age-old things that midwives have done to help women. The positioning, the walking. There was a study in Ireland on getting babies born more quickly by keeping women on their feet. They've even managed to use something called the walking epidural so that they only give them the pain relief, but I'm not sure that that's necessary. There's something really magical about what happens to you after you have a baby, and I certainly experienced this. It's why I wanted to go into teaching. You go through pain and you think you can't do it, and your partner tries to support you, and you get mad at him for the way he does it, and you come out at the other end with this beautiful child who is really going to be yours for the rest of your life, and you think, I'm incredible, look what I did. This is what a woman really is, and I just feel like it's such an important feeling. And of course I did it 7 times, so I got a lot of important feelings. I felt really good about myself around birth, and I really want other women to know that. So that when I teach classes at Kaiser Hospital, I really feel that I want to impart into them the feeling that they have it, that it's a microchip from millions of years ago that they can rely on, that it's in there, and they're going to get that magic if they put into it. So I've tried really hard to do that in teaching.
And it is work.
They need to realize that it's not just a beautiful thought. It's not a book you read. It's an incredible amount of work. And during the time you're doing it, you may feel like, I don't want to do this anymore. I hate this. Why did I decide to do this? And that's when it's rough. That's when it's hard to turn down drugs and epidurals. And you hope that you'll have someone with you, a doula, a labor coach, someone who's a wonderful woman friend, someone who's experienced it and knows what to say to you to help you to get through it.
Tell about the value of doulas.
We have, in our time, brought up an old name, doula, to be with women during birth. Actually, to be with them a little before and a little after to help them become mothers. Doula is a Greek word, and I'm not sure exactly the meaning, but to be with woman, to serve her. The type of thing I did in the 60s was to go with women at their births, and I called myself a labor coach. I was very hated by the nurses at the hospital. The doctors seemed to like me. I think it's because I helped them a lot with keeping the woman under control, and getting her to push. But the nurses were very threatened by the labor coach in those days, and always were talking about, if you make her breathe that way, she may get acidotic. Don't do that, And I really was getting a kick out of how it all worked. I was terribly sneaky in those days. I would go behind the nurse after she would leave and chewed me out, and I would recheck the blood pressure to see if I did it right. I would recheck her exam, steal a little glove and check it out. And the women and I conspired together in those days to have a wonderful birth. We would talk to the doctor about not doing an episiotomy. He'd think she was crazy. We'd bring our own oil to rub on her. We did a lot of interesting things in those days. Now we do them as a matter of course in the hospital because we've managed to infiltrate. And I really am happy. The doctors have their little things of mineral oil they use. If the woman brings a special oil, they're very comfortable about using it now. They're not draping where I work anymore. They're not excluding people. They're letting other parts of the family in. One of my favorite births at Kaiser, I had both great-grandparents there. And that was really astounding to me, as well as the grandparents and the mother who was having the baby, and then the baby. So there were 4 generations. Right in the middle of the birth, the girl had some oxygen on the woman who was giving birth, and she said, I don't want this on. And she threw it down, and great-grandpa said, give it to me, I need it. It was very, but you know how wonderful those people are going to be to that baby. They'll never forget seeing it come into the world. Babysitters, the whole family together. And little children at birth are just wonderful. They've even coined some phrases that I still use. One little boy saw the head coming and the skin wrinkles together because it's all loose. And he said, "Why, that looks like a big walnut." And you know, it really does, especially if there's not a lot of hair on it. So that was a fun kind of a thing, and I use it a lot when I'm teaching. I say, when you see the head, it's going to be all wrinkled together. And so you're going to think of it as something's wrong with the baby, but it really isn't. And then I tell them about the walnut story. Some of my births have given me some grand stories. One was a gentleman who did not seem to be enjoying the birth at a birth center that I was doing because the pushing seemed to be bothering him. And finally he took me aside and said, "Will she ever be normal, on her bottom end?" He said, it shouldn't have opened like that. And so now when I teach classes, I always tell people, remember, the anus is going to open about this big, and it's going to look to you like the baby's coming out of the wrong opening. But the fact is, it's made to do that because it has pleats, and it'll be fine. And after that, he was very joyous about his baby, but I think he was really worried that it had injured her.
So talk a little bit more about that. The anus has pleats, and the baby extends the anus a bit, distends it because the head is coming out underneath.
Right down.
Describe that. And then about the vagina having pleats. Those are beautiful images. So
yeah.
Go again on that.
Our vaginas are...
I want to remind you of just eye contact over here.
Oh, with her, yeah. I
Camera
keep looking
and
over
all
there,
this.
don't I?
Yeah, try not to hang out looking over in this area.
A woman's vagina is quite an amazing organ in that it is all wrinkled inside. And so when the baby gets pushed through the cervix into the vagina becomes a long organ as well as a big round organ because all the pleats in there have opened up. So that works really well. And then as the baby comes down under the pubic bone like this, it aims directly at the anus.
Stop a second. I really want this on film. She's very visual with her hands, so let's take it back
I can put them up again.
Let's do again about the vagina, because that's such beautiful imagery, and Wes will catch it.
Okay.
Okay.
Just do it as high as you can in the frame, because I can only leave
Sure.
so
Okay,
wide.
I can do it up here.
Yeah.
The woman's vagina is a really interesting organ. It starts out about that long maybe and fairly closed with little pleats in it. And when the baby is pushed through the cervix into the vagina gets long like this, about this long, and all the pleats open up. So the baby is then pushed by the woman through the vagina. So it's really amazing. It will aim right down at the anus, which also has pleats and opens up, to about 4 centimeters. And the baby will come under the pubic bone like this, aim right at the anus, opening that up and emptying anything that's in it, and then coming up this way and out of the vagina. So, of course, it manages to make a quick turn and not come out of the wrong opening, which many people fear. So we teach that in class. We do talk to the women and the men and tell them that those things are going to happen.
Tell
That
them
there
about
may,
their body.
yeah, there may be bowel movement. That's perfectly normal. We're used to it. It's not a problem.
Can we tell them how wonderfully the bodies
It's
work?
just
Talk a little bit about that.
incredible. So many things are amazing in our bodies. We have this hormone that relaxes our hips so that the pelvis will get bigger and the baby can come through the pelvis. It's also there to relax all the vessels in our whole body so that we can carry extra blood volume. And women in pregnancy get about 45% more blood volume so that they can feed this growing uterus, the baby, the placenta, the breast tissue, and all that, as well as their own brains and hearts and toes. So the vessels would have to be more relaxed in order to contain that, or she would have high blood pressure. So it causes the vessels to relax.
And
It
then
causes...
she waddles. The reason she
Yeah.
waddles.
When everything relaxes like that, first of all, you'll see the vessels, and you'll see them in her legs. It may cause varicose veins. And the relaxed pelvis may make her walk back and forth, called the pregnant waddle. It also is going to cause her feet to get bigger. So we tell them, don't buy any Gucci's during pregnancy. Be sure that you get, cheaper shoes because your feet are probably going to be bigger, and so are your hips. And they probably will not go back. But it gives you a more womanly look. And we talk to them about how sexy they're going to be after birth because they're going to change into the woman body. And that's what happens with the changes.
So you have to educate women to really adore their bodies.
Mm-hmm.
What about your job with nurses? You told me about what a role you have with nurses and how that has surprised you. It's one of your big jobs. Can you talk about that?
Well, coming into the hospital early in the years, it was harder because the nurses were really in charge of birth. They called the doctor when the head was on the perineum. The doctor may have come in and examined the woman, admitted her, and made orders, but then the nurses carried them out. So the midwife's role in the hospital was somewhat threatening, and I don't blame them because they did such an important job. And really, nurses are midwives too, they just don't know it. What happens is that now, going into the hospitals, I'm finding the nurses are having fun doing births now that midwives are there. They are not looking at so much a job of delivering this baby, but just the whole family unit coming together. Their part in it is to keep it safe and to keep the, the vital signs and watch the baby and all that sort of thing. But they're also adding tasks like, why don't you get up and walk? Why don't you get in the shower for a while instead of thinking about medications? We're giving them other options now to use, and I think they're fun. I think they're having fun with them.
Let's talk about that. One of your big roles, what you see it as one of your big roles, is to bring the joy back to nursing and to show them what normal is.
I really feel that normal birth has been lost over the years. I mean, the years when women were given twilight sleep, they were out screaming when they had their babies and don't remember. What a terrible thing to lose and have somewhere in yourself, I guess it's your unconscious place, there's a knowing about your birth that you lose. And so women were then really needing nurses to keep them safe because they were unconscious, and the nurse had to watch their vital signs, the baby's vital signs, and watch for the baby to show at the opening so that they could call the doctor to put a pair of forceps on and pull it out because the woman was gone. Nowadays, they're not doing that anymore. They don't use twilight sleep. We rarely see forceps at our hospital. We use some vacuum extractors. We have a fairly low C-section rate at our hospital too, and I believe it's because the midwives are helping the nurses to know ways to move the women around, and we're getting more babies born. I had a big compliment by the perinatologist one day. He was on and he said, "Oh, Carole, I'm so glad you're here. I saved this woman for you. I was going to do a C-section, but I'm hoping that you can get the baby out." And I thought that was too touching. I was just delighted. And we did. We got the baby out. But physicians are, really taught how to do the pathological things, how to save the women when they need saving. And so midwife is taught to do the normal things. And he knew that. That was very wonderful. He'd worked with midwives at UC. And so he was waiting to see what I would do. And I got her up is what I did. But what I'm finding is that the nurses are really enjoying some of these changes. They know that we don't do episiotomies. They pour our oil. They get us hot compresses. They're really wonderful about assisting us. We're not draping. They're seeing more of the births. We're using the partners and the people who come to the birth. We say, if you're coming to the birth, you're going to work. If you're not there to help, then you probably should be outside. And so we have them holding legs way back so that we say knees behind the ears. We have a lot of wonderful positions that we use, one of which is squatting with a squat bar and hoping to open the pelvis more. So I really feel like over these years we've changed a lot in the hospital, but we've had to do it carefully. We can't just go in and say, all right, this is the way it's going to be. You have to gradually change people who have a way of looking at birth. And I know that nurses thought that birth was scary before because the baby came out and needed to be jumped on right away to get it breathing. In fact, now they're putting the baby on the mother and letting the baby, be there on her warm tummy with a hot blanket over her. And they're able to listen to the heart rate and assess a baby there, whereas before it was taken right away.
Now, you've worked in a lot of different hospitals. They're not all this good. Tell me how a woman can tell whether her birth practitioner is working in a hospital that supports normal birth. Talk a little bit about that.
Well, this is another thing that women have to look at. They need to do
Let's
some...
say women need to look at.
Women need to look at where they're going to have their baby. What are their practitioners like? They can ask them. I'm not always sure they'll tell them. but they can ask them their C-section rate, their forceps rate. They can tell the practitioner that they're interested in having as close to natural as possible, that they're going to be learning things about their birth and they really want to have some control over their positioning and use of showers. They can visit the hospitals, they can go on tours. You don't have to be a member of that hospital. But the biggest problem I see nowadays is we're limited by our health plans. We have not got a choice in many cases where we go. The health plan may cover X hospital, and usually it doesn't cover more than one, sometimes two, in an area, and the new managed care situations are causing women to be in a plan, and they have to follow the plan. So the only thing they can do as consumers is try to change it by writing letters, by complaining. I had a father one time write to his insurance company and say, look, I've chosen a midwife for my wife and our birth, and I really feel very strongly that this is the safest way to go. As an aside, it's somewhat cheaper because it's not going to be billing for a hospital birth, it's a home birth, and I really feel you should be covering home births because currently you're not. Well, they paid, and from that time on, that company paid. It was wonderful. And I thought he was a wonderful pioneer. I mean, really, we women get out there and pioneer for births, and some of the men look at those things too. I thought that was really great, yeah.
Give me an example of a doctor's birth of a doctor that you remember as a story that was just a wonderful story, blew his mind, or blew the woman's mind. It was just not what they expected. Or something where they just said, my God, I didn't know it could be this way.
Well, I actually did a birth with one doctor who, he was a fairly well-known doctor in Berkeley, an obstetrician, and his wife ultimately became a midwife. He had gone to 3 or 4 of my home births to convince himself it was an okay thing to do. His partner was my backup and had pretty much raved about the home births, and so he and his wife decided to have a home birth. It was her second child and his third, and they were, had both remarried each other, and they had all the children there. Now, she was the one that we had to borrow a baby because her water broke, and nothing happened. And in those days, we did not allow women to labor more than 12 hours without really jumping on them and trying to force the baby out with Pitocin or a C-section. So he became nervous because, of course, the standard of practice within his medical profession was to do this. And so after about 10 hours, he said, oh my goodness, what will we do? And so I said, any babies around? Well, his sister-in-law had a 5-month-old who loved to eat. And so they brought her over, and the mom nursed the 5-month-old, and the labor started. It was wonderful. Now, we ended up, I had the chief of anesthesia there, and he had an entire C-section kit with him in case we had to do an emergency C-section there at home. He, when the birth time came, was in charge of the bulb syringe. The other doctor that was there had been doing home births with me, and I put him in charge of gauze 4x4s and hot compresses. But in general, we left the couple alone. They were very romantic. They hadn't been married that long. They were really a sweet couple. They had a beautiful home. They went up in their waterbed and they laid together while she labored. And we went down and talked and visited, and every now and then we'd go up and listen to the baby. And as it turned out, nothing was really happening, and I decided I just got a premonition. And I went up there and I said, is everything okay? And she said, maybe you better check. And he was lying there with her, looking quite dreamy about the whole thing, wearing white kind of baggy pants and a white shirt, and he was looking kind of ethnic, even though he wasn't. And she was nude in the bed, and I pulled the covers back, and there was black hair showing. The baby was already almost born, and neither one of them had noticed. It was amazing. So we quickly picked her up because she just couldn't move. And waterbeds are hard to deliver on unless you turn the woman just right. The baby kind of gets born into a puddle of water, which comes out of your body. So we picked her up and put her on this special little birth throne that they'd made with beanbag chairs and things. And all the children came, and we had this little baby girl. She was really adorable. And when the cord was out, it was a long cord. It was about that long. There was an argument about who would cut it. And so we gave each of the children a chance to cut it. We had a number of clamps, and we put them all along the cord, and they all cut at the same time. So nobody got the first cut. It was very good. It was a good way to do it. I think that was the idea of one of the other doctors. And I think that the chief of anesthesiology really liked the birth. I think he was quite pleased to see the way a normal birth happens. The baby went up there. He was concerned about the baby because that's one of their jobs in the hospital. But the baby hadn't had drugs. We don't use drugs at home. And it was a nice, healthy, probably over 8 pounds, I don't remember how big, baby girl who began to cry and wanted to suckle. And so that worked really well. He saw a baby that was completely normal, not a baby that had been anesthetized, not a baby that had been taken away from its mother and wiped off. All the vernix also will, this white creamy stuff will actually sink into their skin and help them not to be so dry after they're born. But in the hospitals, they wipe it off. They just love to wipe all that off. I hate to do that to them. I think it's a normal thing for it to stay on a baby.
Talk about the smell of amniotic fluid.
Amniotic fluid is something, now we teach this in class too, and I think they think I'm a little racy when I talk about this, but amniotic fluid smells a lot like male semen. And so I tell them that in class, that if your water breaks or you think it's broken, collect some of it on a pad and sniff it. Midwives do the sniff test, you can too. So you sniff it, has no odor, it's probably just normal mucus or, watery discharge that you have. If it has a bad odor, it could be an infection. But if it smells a little like when you make love, that's your water. And so people will call in and they'll say, I did the sniff test. Well, the nurses didn't know what that was, although they must have been aware of the odor because there is a peculiar odor to water. And they must have been aware of it but had never put a name to it.
But with all the betadine.
Yeah, there's other things that you put on the woman, and we don't use that anymore. But
let's say something about in a hospital, all the smells are.
Yeah, a lot of the smells in hospitals will be, a woman will come in and she'll find that there's alcohol smells. There'll be many other odors there from cleaning the room, things like that. And so they may not really identify the odor of water, although more and more now we're smelling things like onions and potato chips because people bring their food in, and we often have to ask them not to bring it in the room just because the mother might get sick from it, smelling it. Your sense of smell is very acute in pregnancy and labor.
Beautiful. Tell me about birth centers.
Well, birth centers are, I believe...
Let's say birth centers.
Birth centers?
No,
No, well.
well
Okay,
first.
okay. Birth centers are something that came to be when a lot of people were doing home births, and people wanted to bring them out of the home and into the hospital and make it more welcoming. First was alternative birth centers, or ABCs as they call them. And my job in the 70s, one of the jobs I did was to go around and begin ABCs in several hospitals in the East Bay, and one in Marysville, one in San Francisco, 2 in San Francisco actually. And it ended up to be quite an interesting job because I was at that time a lay midwife. I really was quite frightened about going into the hospital and speaking to the OBs about how to do a birth in an alternative birth center, and I didn't see why they wouldn't know how. But it turned out it was because they were used to having a bed with stirrups and the bottom broken and everything handed to them, and they had to really kind of change their way of thinking. Some of the doctors in the alternative birth centers invented these weird things that they would slip down so they could put stirrups up. I thought that was cheating, but they did. I then found that birth centers came to be, and I think birth centers are a very nice alternative to people doing regular hospital births. But many of the birth centers are now, out of hospital, and they're in homes that they just look like your house when you go in there. There'll be 2 or 3 birth rooms. There's a tub. There's access to washing, so you bring your own sheets. You can wash them afterward. Kitchen, you can bring your own food. There's some wonderful things. A midwife and a nurse will arrive, and they'll stay there till the birth is over. And then they'll usually send you home fairly early. Now, in the 80s, 70s and 80s, women left the hospital early, and that was quite an innovation. People were staying much longer, 2-3 days after a birth. Now, in the 70s and 80s, they wanted to stay 2 to 6 hours. So there had to be things like home visits, people coming out to see you afterward to be sure you were still alive and the baby was normal colored and all that sort of thing. And when we did home births, of course, we had to do home visits on the women too.
Let's talk about that. Midwives always.
Yeah, midwives are very used to seeing you in the postpartum period, talking to you about breastfeeding, checking the color of your baby, the cord on the baby, making sure that you're doing okay, if you had any stitches, how those are healing, checking to see if you have help, perhaps cooking up some soup, staying there and doing the laundry. So in a way, this is kind of a doula role, a service role. I know I've gone out and shopped for women at times from home births, and the home birth scene was so wonderful. So the birth centers have to include this also. They will go out and see you at home afterward, unless they have a group visit. Now, what I found at our hospital is we have an in-hospital birth center where they welcome the family. They have access to a little kitchen. They have showers and quite a large room with table and chairs, as well as a little bed for someone else to sleep, and all the equipment that they might need if they had to do an emergency forceps birth or a vacuum birth, and a C-section room across the hall. But they also will leave within 12 to 48 hours. Now that will be up to the doctor, the woman, how the baby's doing and all that. When they leave before 24 hours, we are required to do some kind of home visit or have a group visit in the hospital. So we bring the people back, if they didn't have a really complicated birth or a C-section, days 3 to 5, and ask them to bring their baby and sit around in a circle. And there is such a value in that. Visiting a woman at home alone is wonderful, but having a group is really great because she picks up the feelings from the other women. She may meet women that live in her neighborhood or in her area, and they can get together. My daughter had her baby at home and joined a birth group and is still in the birth group 9 years later. Although she's moved away, when she comes back to visit, she visits those women. They shared things like, I'm up all night. What do you do with a crying baby? How about your husband? Is he complaining that you're not paying any attention to him? Is he being involved with the baby care?
Could we say something about the postpartum generally? Like the postpartum is the time after birth, because we have film number 2 is the first 30 days after birth. So if you could just address that, the first 30 days or the first moon, as they used to call it.
First moon. Yeah, the first 30 days or moon after the birth is really magical. It's kind of a time warp, because I felt when I had my children that the world went away. I was at home with a little baby that I'd waited so long for, and at last I could care for the baby, I could breastfeed, but what I didn't bargain for was I had a sore bottom. It was hard to sit down after my first one, not after the others, but I had had stitches that hurt, and I didn't realize that it was day after day, 24 hours a day, waking up 2 to 3 times at night, a baby crying for an unknown reason. I was a 20-year-old mother then, and I didn't know exactly what to do. I didn't have girlfriends with children at the time. My mother had not cared for my brother and myself when we were born, and so I did call for the aunt, who never gave birth but did care for us when we were born, and asked her questions, and no one in those days wanted to breastfeed, and so I was the only breastfeeding mother that I'd even heard of. In the hospital, for instance, I was the only one breastfeeding. And so I really had a lot of ambivalent feelings about why did I want to be a mother, and yet I loved the baby so much. And when my milk would let down, the prolactin would flow through my system, and it would make me calmer and make me love this baby. But in between, when I was so tired, I'd often think, oh my God, don't let the baby wake up. I'd be angry at someone who slammed the door. And I think women don't get enough rest in those times. So I do try to talk about that in my classes, that there are 4 trimesters to pregnancy. There's the first 3 months when you're a little nauseous, the second 3 months when you feel so wonderful you can't believe it, and the third when you're getting ready to give birth and your hips are hurting and you're waddling. You go to classes, but the 4th one we tend to discount. We don't have classes for that. It's the very most important one in a way, because it's the beginning of your life as a parent. The birth is the ending of your pregnancy and the beginning of your life as a parent. You really have a lot of things to learn. They're inside of you somewhere, and you have to trust your intuition. And that's always hard for us to do, because in this day and age we think we have to have a book to read about it. We have to be told by our pediatrician how to do it. And so it's very important to give mothers support through those weeks afterward. I always tell them, tell your friends to bring casseroles. Don't allow visiting except 2 times a day. Make sure you nap like it's a job every day. And be sure that you share the baby with your partner, because the other person living in the house can do it really well too. You'll be sorry if you don't, because I often didn't do that with my children. It was not really done in the 50s and 60s. And I'd sort of say, well, I'll take care of the baby, or here, do it this way. Everybody has their own way. Men, other women, whoever you're living with, they can take care of babies too. So give yourself a break. I try to really tell them that, and